Hello everyone, this is your Dr. Akash Chakravarthy. Today we're talking about root canal treatment. Why do we do it? Can't we just do a normal filling? Is it necessary? To understand what a root canal treatment is, you need to understand what a dental caries is. Dental caries is caused by destruction of natural tooth structure due to bacterial activity. Now, there are three layers in a tooth. You start with enamel, and then you have dentin, and then you have pulp. Now, this pulp layer is the most sensitive layer. It consists of nerves, blood vessels, and all the life form of the tooth, right? Now, when a cavity enters your enamel, it can be treated by just a normal filling. When a cavity reaches your dentin, there are a few additional procedures to do along with the normal filling, but it can still be treated with a normal filling. But when a cavity enters into the pulp, then we cannot do a normal filling. You have to get root canal treatment. In the process of root canal treatment, the entire pulp of the tooth is removed and the root canal is cleansed and disinfected, and then it is filled with an inert material called gutta-percha. After that, the tooth structure is modified and then a crown is placed on the tooth structure. This is a typical process of a root canal treatment, and it can take anywhere between 2 appointments to 3 appointments. Now, why do we need a crown after a root canal treatment? This is because a root canal treatment as I mentioned, the pulp of the tooth carries the life form of the tooth. Now, during the root canal treatment, we are removing the pulp of the tooth, thereby removing the life of the tooth. This will make the tooth structure brittle, thereby subjecting it to breakage on any application of force. So to prevent the further damage to the teeth, we place a dental crown on the top of the tooth. Now, earlier, let's say 30-40 years ago, when the cavity reaches the pulp, the only other alternative was extraction of teeth. Now, you should view root canal treatment as an added bonus for that tooth which would have otherwise been extracted. The life of the tooth after root canal treatment can be anywhere between 10 years to 15 years. What are the symptoms which will indicate a root canal treatment? Typically, you will have a sharp pain with sensitivity to hot and cold substances, and sometimes even swelling and pus out of your gums near that tooth region. What are the possible side effects of root canal treatments? If a root canal treatment is done properly, there are no major side effects for root canal treatments. Even if there are very minor and they can be easily managed with a few medications. Another consequence could be improper sterilization of the instruments that are being used, which can lead to further infections. There are a few possible complications during the root canal treatment. Sometimes the roots are calcified, which will increase difficulty level for the root canal treatment. Sometimes the roots are curved, sometimes the number of roots are more. All of these would lead to increase of the time of root canal treatment, or the number of appointments for the root canal treatment. So do not delay your root canal treatment. Go to the right dentist and be in safe hands.